That said, we're still working on getting folks vaccinated. 45% have gotten at least one shot in South Carolina. That's not where we want to be. We are working on getting the 12 to 15-year-olds vaccinated because they just became eligible yesterday. So we are actively working with Superintendent Spearman in the Department of Education and with all the school districts, trying to offer as many vaccine clinics in the schools before they let out for summer as we can, actually with parental consent, but we are moving very fast on that because we only have 2 to 3 weeks, of course. And then obviously setting up other opportunities for that age group to get vaccinated. One of the big things we're focusing on now is rather than doing vaccine events, doing vaccine ad events. So we are going to be in some of the state parks on the weekend, starting Memorial Day weekend. We're working with Director Parrish from the State Parks Directorate and working on, maybe potentially giving folks free admission to the state park if you come in and get your vaccine for the day. So I think that'll be a positive. We're also going to be going out to a lot of fairs and festivals and that sort of thing and have a vaccine table there. Knowing there's really going to be a lot of folks there, they can come in and get their vaccine while they're at the fair. We're also looking at contracting, putting out a request for contracts for more mobile units to actually go out into the communities almost street by street, offering people vaccine right where they are, in the goal of getting as many folks the vaccine as we can. As you know, the masking has been an issue. The governor issued an order earlier this week, basically prohibiting mask mandates based on his previous orders, and also saying that parents have the opportunity to opt out of mask requirements in schools. Certainly our guidance is that masks are still helpful. Masks still prevent disease. We strongly recommend that communities retain mask mandates to the degree that they can, and that children in schools continue to wear their masks. We did, as directed, create an opt-out form, which is on our website, for children to opt out of wearing masks in schools. But it clearly says that if you do that, you're accepting all the liability as a parent. And we strongly recommend mask wearing through the end of the school year, with the hope then that we will not have to do that next school year. COVID, we continue to have the FEMA site in Columbia. If you came in on I-26, you saw the signs for that. Still doing a couple hundred folks a day there, so we're happy with that. We're going to be having an hour on SCE-TV, the statewide public television service, on the 20th, talking about vaccines and having some roundtables and things that people can watch and learn more about the vaccines. We're also working with numerous community organizations, setting up new vaccine clinics across the state. In churches, we're working with the AME Church, we're working with the NAACP, we're working with various groups that have mobile units. Again, trying to get the vaccine out where folks are and using trusted local leaders to help promote the vaccine. I think hesitancies are a bigger issue now. There is still an access issue, to be sure. In some of our communities, especially the rural areas, it's still hard to get to the vaccine. That's why we want mobile units literally driving down every street we possibly can, offering vaccine, and doing it through the churches and that. But I think hesitancy is becoming a bigger issue for us. There's two groups that we see mostly with the hesitancy. One is young folks, 18 to 35, especially African Americans, 18 to 35. There's a significant hesitancy there. The other is conservative, politically conservative. There is some hesitancy there. There's some natural distrust of government anyway, and they see this as a government program. So we're working with some things there, again, working with local community leaders that they will hopefully trust to try to get more vaccine into those folks. Yes.
One idea that came up was the possibility in an area that's underserved to get for the communities to have a competition, and whoever gets the greatest number or the greatest increase gets recreation equipment for their parks, or something along those lines, so that the folks who are local take ownership and have skin in the game.
Yeah, absolutely. I think we're changing two things. One is we're getting away from vaccine events like the FEMA clinic. The FEMA clinic's great, and it's doing okay. But that's why I said we want vaccines at events, where we want to have a vaccine table where people already are, whether that's a state park on a holiday weekend, whether that's a fair or a festival. We think, if you're walking by and you see the table, and we say, hey, do you want the vaccine? That's our chance to get you and give you that vaccine, and then you're probably going to be there for 15 minutes anyway. So we think that's a great opportunity to get folks where they are. I do think we are looking at incentives. Free admission to a state park, that's not a huge incentive, but it's something. There are some legal restraints on what we can do incentivize-wise. There were some proposals in the recent budget proposal. Those did not pass. But we are certainly looking at what we legally can do, whether that's, giving reduced price admission to somewhere, maybe partnering with a company or a restaurant or something. So we are certainly looking at, can we partner with private organizations to give some sort of benefit, whether that's, maybe a discount on food or something, to encourage folks to get the vaccine at that location. We're open to almost anything that will encourage folks to get the vaccine, and that's legal.
The current vaccines that are being distributed, does it cover that variant? And if not, what are we doing as a state to be ready in case that variant starts coming down?
We think we do have some of that variant here, first of all, in South Carolina. And we do think the current vaccines cover it. It does transmit more easily, but it does appear to be susceptible to the vaccine. So that's the good news. But certainly we're tracking that. If there was, a different variant percent that came out and was not susceptible to the vaccines, obviously we need to go back to masks and all the precautions that we still recommend for that very reason, but you can probably double down on those. Right now we're at about 38, almost 39% fully vaccinated of South Carolinians, and about 45% who have at least one shot. Obviously we want much more than that. We have a number of things that we're either about to launch or have launched to support vaccination efforts. We have the Shot and the Chaser campaign, where we've partnered with a number of breweries through the South Carolina Brewery Association, where, obviously you have to be 21, but if you're 21 and you get a shot from a participating provider at one of these breweries, you will then get a free drink. And that's proving to be popular because we're really trying to get younger people vaccinated. That's our weakest group right now. The very lowest number of people vaccinated is in our 20 to 26 group. And we think this is a good way to reach out to some of those folks. So that's, I think, is going to be a positive move. We continue our Vaccines at Events campaign. We're going into a number of festivals and fairs and that over the next few months. This is the season for those. And we'll have vaccine tables at many of those events. We're still working with the state parks to have vaccine tables and state parks, especially on busy days, and working with them at least some of the time to give free admission if you get a shot as well. So not huge incentives, but things that I think will help. And most importantly, just having the vaccine available where people are, and especially where younger people are, which is our number one target population right now. We're also have a contract that will be closing soon to put mobile units across the state and make vaccine available almost street by street if we can. Again, we want to make it as easy as possible for folks to get the vaccine. We're trying to overcome hesitancy with these efforts. Because again, if you're running to the table and you're at a state park, you're at an event, and there's educated folks there that can answer your questions, you just might take the shot when you wouldn't have otherwise. And obviously we have, as you can see, adopted the CDC guidance after our own review of the literature that folks who are fully vaccinated do not need to wear masks in most situations, either indoors or outdoors, with a few exceptions. We do still recommend that unvaccinated people wear masks. And again, and certainly for folks coming to visit us, same policy applies. If you're not vaccinated, we ask that you wear a mask. If you're fully vaccinated, then you don't need to.
What incentives are you doing to get people who normally don't do these kinds of vaccinations?
Well, like I said, we have the brewery, we have the state parks. The state legislature looked at some larger incentives. Just yesterday, when they were looking at the House Ways and Means Committee was looking at the finance bill, there was a proviso to start a lottery like some states have. That failed. There was also at one point earlier on a proposal to give college scholarships, which some states have done. That also failed. We've looked at that. I don't think we have the legal authority to do a $1 million lottery, and I'm not sure we'd want to anyway. But we are certainly looking at alternative incentive potentials and working with some of our partners on that to see what we can maybe partner with private industry that they could offer the incentives working with us. And that's how the breweries are doing it. That's a joint DHEC Brewers Association campaign. And we're certainly reaching out to other retail groups to see if we can do some of those things. We will have a week of COVID service starting June 13th. And we're partnering with many of our providers, pharmacists, doctors, hospitals, and they're each going to have their day when almost every pharmacy in the state that has vaccine will be giving free vaccine, no appointment required. We'll have a hospital day. We'll have a faith day where faith-based groups will be encouraging individuals to get the vaccine either at their worship service. The worship leader, pastor, priest, whatever it is, will be encouraging the use of the vaccine. And then we're also working on a day of service, which a couple of other states have done very successfully, where we're actually going to encourage volunteers and train them up to go door to door, or at least or talk to their friends, their neighbors, people they know. I mean, I don't expect them to not go out the door cold, but talk to people they know who have been vaccinated and do some education about how to talk to folks about the vaccine, give them the information they need, and get them to go out and encourage folks to get the vaccine. We think if someone you know, someone you trust goes and asks you for the vaccine, that's going to be much more effective than if I or Keith or Dr. Traxler, smart as we may be, or not, but it's much more effective, I think, if someone you know talks to you about it than someone you don't know. So those are all things that are coming. So some of those are incentives, some are not. But I think we're using incentives to the degree that we can with our legal authority.
I thought that's all where one
Yes, sir.
of the educational areas had done, encouraged bonuses for teachers to
Yes.
be vaccinated.
Yes.
Have you seen, is that being done?
To my knowledge, no. I know some private companies are doing that here. So some private companies are, including, I think, some of our hospitals. And we're certainly fine with that. We encourage that. I think the incentives, number one, are most effective when they are things that people want, when they target the populations that are having the lowest rates, which for us is mostly young folks. I can tell you one that we're certainly encouraging and I think would be very helpful is that businesses gave people time off to get the vaccine. Basically sick leave or whatever you want to call it. But hey, if you go get the vaccine, we'll give you today off and we'll still pay you. I think if we can encourage businesses and others to give people paid time off to get the vaccine, and if they have a side effect that keeps them out of work for a day, they don't lose that day. Things that encourage people to do things because others want them to help. So again, I think when we can find things like going to the bar, heck of a better way to put it, but when we can find things where people are going out with friends and the friend says, hey, let's go get vaccinated. Actually, those kinds of things have been shown in the past to be very effective. So,
You're kidding.
no, I'm serious. If you look at the literature, there's evidence that when people go do things in groups, they're more likely to do them than if we try to get them to go out on their own.
Suggestion.
Yes, please.
Could DHEC make a statement that coincides with the CDC as far as racism, where they stated that it is a serious public health threat? I think that will go along with the African American community, because so far, as far as I know, DHEC hasn't made a statement, and that will mitigate some of these health disparities, and there will be it will address the distrust with the vaccines.
But certainly, I think we should consider the folks who had the disease as being immune for some period of time.
Do we have any indication of those who have vaccinated who may have also gotten COVID after they were vaccinated?
We do. There is now
I know it's
low.
Results is.
Yeah, I can tell you nationwide, out of 100 and now I think about 70 million vaccines that people who've had at least one vaccine, about 500 people have died of COVID in that cohort. So that's about 1 in 400,000, as I recall. So it's about 1 in 400,000 after vaccination will still die from COVID. So that's a very small number. It's still too many, but and obviously no vaccine is 100% effective. That's true for other vaccines too. But there is certainly a chance of getting COVID after vaccination. It's certainly well less than 1%, which is actually remarkably good compared to
And
most
most
vaccines.
are mild.
And most of the cases are
Are
mild.
mild.
Yes, they are. They are not requiring hospitalization. They are not requiring intubation, thankfully. So even if you do get the vaccine, the disease after vaccination, it tends to be much milder than if you weren't vaccinated.
Right.
We continue, of course, to encourage very strongly folks to get vaccinated. Vaccination is how we are going to stop this thing. The Delta variant is susceptible to the vaccine. So if you are fully vaccinated, you are protected against the Delta variant, just like every other variant so far of COVID-19. So we are pushing hard on vaccines. We will be soon deploying mobile units, getting close to finalizing those contracts and deploying mobile units into the field. Our goal is to have those into every community over the next couple of months to make the vaccine as easy as possible for people to get. Obviously, we recognize that the vaccine is a personal choice, but we strongly encourage folks to get it. We encourage them to get accurate information because there is a lot of misinformation out there. In fact, the U.S. Surgeon General is going to be releasing a report on health misinformation on the web and social media this afternoon, which I think will be very informative. The Pfizer vaccine is available for those 12 and over, and certainly as we're starting to see more and more cases come up in children, we strongly encourage those 12 and over to get vaccinated. And we're actually seeing, our lowest percentage is not the 12 to 19-year-olds, it's 20 to 26. We are continuing to roll out vaccine at fairs and festivals all across the state, again, to make it easy to get where people are, working with the state park system to have the vaccine available in a number of our state parks. And in many cases, if you get the vaccine while you're there, you'll get free entrance to the state park for that day. So really working on, like I say, making it easy to get. We are certainly recognizing that as we move forward, if they're not vaccinated, then we still strongly recommend that you wear a mask, that you socially distance, all the precautions that we recommended for everybody several months ago. One of the things that being fully vaccinated, which means either 2 shots of Moderna or Pfizer plus 2 weeks, or the Janssen shot plus 2 weeks, if you're fully vaccinated, then you don't have to wear a mask anymore. You can if you want, but it's not really necessary. And your chances of getting the virus are very, very low. We've been tracking, and you may see our report that over a 2-week period, none of the deaths in South Carolina were amongst those who were fully vaccinated, and well over 90% of the cases are in those who were not fully vaccinated. So vaccination works. We just need to get the people to do it. We're just about at 50% having gotten 1 shot. That's too low. Our goal is to be over 70%. That's been our goal. It's still our goal, and we're working hard to get there. We are tracking the proposed federal plan on requiring immunizations for COVID for businesses that have over 100 people, 100 employees. We've been working with Department of Commerce and other state agencies and some of our private partners looking at that. We've determined that there are probably, based on the average age of the working population, the number of people that work in South Carolina for an employer of that size, there are probably about 600,000 unvaccinated employees at facilities that have 100 or more workers. In other words, and would likely be covered by the Biden regulations, the Biden plan. So we are working with our partners to make sure that if that plan does come to fruition, obviously we don't have, that's not in regulation yet, but if it does, we want to make sure we're ready to support the businesses of South Carolina. And so we are working diligently to make sure that either testing is available, because right now our understanding is it'll either be testing or get vaccinated. We don't know for sure what the percentage is of those folks who will choose to get vaccinated. We're hoping that it's high. And we certainly will have vaccine ready. And some of these mobile units could in fact go to some of these businesses if they have enough people. If they say, hey, we've got 50 folks for you that would like to get vaccinated as a result of this new change, we'll send a mobile unit in there and get those folks vaccinated. But if they want testing, that is going to be a big lift. That we'll have to look at how that testing is paid for and also who provides that testing. So that is something we're actively working on right now to make sure that no businesses are left in the lurch if this does come to pass. So just want to let you know that we are actively working on that project to make sure we are ready.
Do we know the percentages of those vaccinated with Moderna and Pfizer who have been hospitalized? I'd like to know a breakout of the Pfizer, the Moderna, and the J&J, and the hospitalization of those folks and ventilators and the such. Do we have that data?
But Sonny, we can definitely get that for you. So we'll send you some of that information. That we've been working on that request for you, and I know we had to make a few edits to it and send it back, but we will get that for you here shortly. Obviously, as we've said, the number one way to prevent COVID is to get vaccinated. And that's why we're doing all these things to try to make access to vaccines as easy as possible. We strongly encourage folks to continue to get vaccinated. Certainly children 12 and up are now eligible, and we encourage parents to get their children vaccinated too. In addition, for those who are now eligible for boosters, I think getting the booster will also help avoid another surge during the holiday season, which obviously we're all concerned about. We still recommend masking when people are indoors, especially if they're with people they don't live with. That is still our recommendation, social distancing. Also, the CDC yesterday came out with a much stronger recommendation recommending vaccines for pregnant women, that there is good evidence now that, when pregnant women get COVID, it's a worse outcome than for the average person, and that they're safe. So we are actually partnering with a number of different medical associations, the Hospital Association, to put out a statement strongly recommending pregnant women get vaccinated. I promised I'd always go to the science, and whatever the science said is what we would report, and so that's what we're going to do today. I know that the science clearly shows that vaccination is the best way to defeat COVID-19. However, in our student population, many of them are not yet eligible for vaccination, as vaccinations are only available to those who are 12 and older. And even in that population, the vaccination rate is relatively low, right now we have about 20% of those who are aged 12 to 19 in South Carolina who are actually fully vaccinated. So it's a very low number. Therefore, since we don't have the ability to rely only on vaccinations to prevent COVID in our schools, we need to look at other potential means of doing so. And certainly one that has been discussed extensively is masks and wearing of masks in schools. Strictly from a public health standpoint, the best way to protect our children is to require the use of masks by everyone in the school. There are, whether or not our schools are allowed to do that, I think is a question that is an open one. I know there may well be a legal case regarding that. I'm certainly not, an expert in that area, and I can't really comment on that part. But certainly I think we know from the public health standpoint and what the science shows that if we want to protect our students, and for that matter, everyone else in the school, but especially our students, and keep them in school, we should require masking.
In light of the data received and reviewed today by DHEC, I move that the chair and director of DHEC contact leadership of the South Carolina House and Senate, urging them to consider providing local decision-making authority regarding mask mandates in schools.
Second.
All those in favor say aye.
Aye.
Opposed? Ayes have it.
We, of course, also last week started offering shots to 5 to 11-year-olds. The Pfizer vaccine has now been given emergency use authorization for 5 to 11-year-old children. That's a big plus for us because it's going to help our schools a great deal. And just in the last, 6 days, we started last Thursday. We've been vaccinated over 7,000 children in that age group. So we're very happy about that because we know vaccination is going to be the number one way that we get out of this pandemic. Still more work to do. We got more folks to get vaccinated. At this point, the department still recommends the wearing of masks indoors and also outdoors in crowded events like a very crowded football game. We think that we're coming to the point in the not too distant future, if these trends continue, big if, that we may be able to change some of that guidance, and we are certainly looking at that. But for the time being, we still think the safest course is to require masks. So we're recommending that at this moment. I think now that we can get everyone 5 and above vaccinated, that will help us as well. I think now that we have more than 55% of the general population vaccinated, fully vaccinated, and 63% at least one dose of vaccine.
If you add the vaccinated individuals to the people who've had the COVID,
Yes.
What kind of number does that represent?
It's hard to know for sure because some of those folks vaccinated have also had COVID, of course. Mm-hmm. And we don't collect that information, if you're vaccinated, did you have COVID? We don't ask that question. So, we don't know for sure what herd immunity is, but if you're asking me, do I think we're getting there? Yes, I do.
How about hospitalizations, the vaccinated versus the unvaccinated? Is that percent still mainly very high on the unvaccinated?
Yes. Now, the good news is the number overall is down a lot, right?
Right.
The number of hospitalized patients, the number of patients on ventilators has significantly
But that number's still up.
But still, the vast majority, I'd say a significant majority, about 80% of those hospitalized are unvaccinated. Obviously, we still are recommending that folks take appropriate precautions. We're a little bit over 50% vaccinated statewide, fully vaccinated. We need to get that higher. We're giving out a lot of booster shots. That's good news. The booster shots are actually pretty popular. So we're moving forward with those. And of course, everyone now 18 and older who's been vaccinated at least 6 months ago with either Moderna or Pfizer or 2 months ago with Janssen is eligible for a booster shot. We at DHEC are a little bit different than the CDC guidance and the FDA guidance in that we do recommend that if you got the Janssen vaccine, your booster should be either Moderna or Pfizer. There is some evidence that suggests that getting Moderna or Pfizer gives you a better antibody response than a second dose of Janssen. That evidence is not totally conclusive, but we think it's sufficient to make that recommendation because there's really no downside to doing it that way. Also, we are moving forward on our vaccination program for those 5 to 11. That rate is somewhat slower. We're still down around 4%. We are certainly, Brandon, go ahead.
Oh, no, just the 4 is completely
Yes.
vaccinated.
Completely vaccinated, yes. So we're about 4% completely vaccinated. Obviously, we need to do much better than that in that population. We're really strongly promoting the vaccine for the children and hoping that we can get greater uptake in that group over the next couple of weeks. And maybe as they're out of school, that's a good time for them to get the vaccine too. We do still recommend the wearing of masks indoors, including here at DHEC. We are recommending social distancing when possible. We are certainly continuing to evaluate those recommendations. I think at this point with Omicron still being a little bit uncertain of what it's going to do and the uptick we've seen in cases, we've been running more than 1,000 cases most days over the last week, 2 weeks. We're going to leave that recommendation in place over the holiday and then reevaluate come January. As a reminder, you can get the flu and the COVID vaccine at the same time. That's perfectly safe and perfectly effective. So we are certainly encouraging flu vaccine as well. We've had now at least 1 death from flu in the state. We'd like to keep that, not increase that, and keep that at 1. But that's going to require more folks getting vaccinated.
Team, could you speak to the relationship of boosters for vaccines relative to the Omicron variant?
Sure, as much as we know. And Brandon, please jump in here. The boosters do appear to increase protection against the Omicron variant. There is some emerging evidence that the Pfizer vaccine may not be as effective against Omicron, but the booster seems to help that issue. Boosting certainly any of the vaccines appears to give better coverage against the Omicron variant. And again, it's early data, so we don't know for sure. But certainly, I think we would strongly recommend that for those concerned about Omicron, and really for anyone who's been vaccinated and has been either 6 months or 2 months, that they go ahead and get the booster. The evidence does seem to show that the booster will help protect against the Omicron variant.